This is Dan Dix here, reporting for Press for Truth, coming at you here with another COVID-1984 update, and we've got a lot of information to cover in today's video, guys, so let's just jump right into it. Today we're going to take a look at this. Canada resists pressure to drop vaccine mandate for cross-border truckers. The industry group estimates that 10% of drivers could be affected by this. Prime Minister Justin Trudeau is pushing ahead with a vaccine mandate for international truckers, despite increasing pressure from critics who say it will only exacerbate driver shortages and drive up the price of goods imported from the United States. Meanwhile, I'm sure you already are well aware the provinces are now considering mandating COVID-1984 vaccines, federal health minister says. With healthcare capacity stretched too thin in the face of an unrelenting wave of COVID-1984 infections, Canada's health minister says provinces and territories should be considering mandatory vaccinations. Yes, ladies and gentlemen, what I was called a conspiracy theorist for even suggesting may soon be a thing. Well, now the provinces are openly discussing the idea of mandatory COVID-1984 vaccines. This comes despite the fact that they're basically already mandatory. They're de facto mandatory when you see things like this, guys. More than 350 TTC employees have just been fired for failing to comply with COVID vaccine mandates. Yeah, you ask these 315 people if they think that vaccines are mandatory, and I think you'll find they say that they are, because they've just been fired for failing to comply with these vaccine mandates. Here in New York City, we're seeing they are now requiring booster shots for healthcare workers. There's no test out options here, so it's mandatory boosters in New York already if you're in the field of healthcare. Meta delays office reopening, and they are now mandating the booster shots for returning to work. So we're seeing a little bit of a pattern here, guys. Mandatory boosters and mandatory shots are the thing, despite the fact that here in BC, for example, most new COVID-1984 infections are now in fully vaccinated people, with nearly 90% of BC residents aged 12 and up having had 2 doses of COVID-1984 vaccine. The rapidly spreading Omicron variant is infecting vaccinated people in 4 out of 5 cases, according to the latest data from the BC Centre for Disease Control, guys. So we're going to look at that. We're also going to look at the fact that the HKPR report reports 2 deaths, 1,145 active cases with 10 in hospital, and that's 80.5% of them are fully vaccinated, ladies and gentlemen. Fully vaccinated, 80.5% of them. But that doesn't stop Justin Trudeau from wanting to pump you full of these boosters. There's enough vaccines for all Canadians to get a 4th dose, Trudeau says. The government has secured enough COVID-1984 vaccines for all eligible Canadians to receive a booster as well as a 4th dose. This is just leading into the realm of pure insanity, ladies and gentlemen, because new reports are coming out all the time showing things like this. COVID survival rate for people under the age of 20 is 99.9987%, according to the Stanford Epidemiology Professor study. Top epidemiologist Professor John Ioannidis has published a new study which concludes that the survival rate of people under the age of 20 who catch COVID is 99.9987%, guys. But we still have parents freaking out, putting masks on their children, shooting up their teenagers, when it's absolutely all based on total hype and fear. Meanwhile, here in British Columbia, they just had a town hall meeting where they talk about boosters, adverse effects, and the super immune, guys. And you won't believe what Canada's top doctor, Dr. Bonnie Henry, had to say about this. Check this out. She says, "What's important here," Henry added, "is that all eligible British Columbians get their booster dose." And get this, guys, double-vaccinated residents who have already been infected. So they've got 2 vaccines. They've already built up the immunity because they've contracted COVID. So double-vaccinated residents who've already been infected by COVID may benefit even more from a booster than those who haven't. What we're seeing is that people who have had a vaccine and infection and then get their booster dose are basically super immune, she says, my friends. And I think this is going to go down as one of the greatest health blunders of the 21st century. So we're going to take a close look at that, guys. And Finally, we'll take a look at this. COVID vaccine microchip can allow your moves to be tracked with smartphone technology, warns expert. A tech expert has explained how our phones will make it possible to follow the movements of those who have the microchip. And you may be sitting here saying, what? Is this even a thing? Well, as I put out just recently on Twitter, just the fact that this is even being openly discussed right now is quite mind-boggling. I'm not surprised it's happening. I've been warning about it for nearly 2 decades. I'm just surprised at the speed at which this agenda is accelerating, my friends. So we're going to talk about all of this stuff and much, much more in this video, guys. But before we do, I'd ask that you check me out here at pressfortruth.ca/donate if you appreciate my efforts to continuously counter all the propaganda that we're being bombarded with by the mainstream. If you do appreciate my efforts, you can do a one-time PayPal donation by clicking on that banner there. If you're into the Bitcoin space, you can click on this banner to contribute some Bitcoin. If you're on Patreon, or even if you're not, you can sign up and become a patron of mine by clicking on this banner here. I also accept other cryptocurrencies. You can check that out there. We also have a reoccurring monthly contribution that you can sign up to here that doesn't pay to a third party like Patreon. Here, you can send an e-transfer direct to dan@pressfortruth.ca, guys. And if you prefer to keep things old school like I do, you can send cash or checks or equipment or simply just words of encouragement. All that can be sent to my P.O. box, guys. Links are all located in the description below. Thank you so much to everybody who helps me in this COVID 1984 nightmare to battle all the propaganda. Without you, I couldn't do this work. So once again, thank you if you have contributed. If you haven't, please check the links in the description below. All right, guys, let's start with this. This is the CDC director, okay? The director of the CDC telling you that 75% of the deaths that have been chalked up to COVID have occurred in people who had at least 4 comorbidities, meaning they were admitted into the hospital for something else. They died because of something else, like maybe cancer or something like that. But because they happen to have had tested positive for COVID at the same time as their death, it gets chalked up as a COVID death. And this is the CDC director telling you this, not me. Get a listen to this, fellas.
I want to ask you about those encouraging headlines that we're talking about this morning, this new study showing just how well vaccines are working to prevent severe illness. Given that, is it time to start rethinking how we're living with this virus, that it's potentially here to stay?
The overwhelming number of deaths, over 75%, occurred in people who had at least 4 comorbidities. So really, these are people who were unwell to begin with.
You know, a lot of people are not going to understand like the severity of that statement, the impact, like what she's actually saying there. Most people will just dismiss this because as soon as this segment is over, they're going to talk about how important the vaccine is, and people will fall back into the brainwashed conditioned programming. But let's just listen to it one more time, because this is so important
this virus
to understand.
Potentially here to stay.
The overwhelming number of deaths, over 75%, occurred in people who had at least 4 comorbidities. So really, these are people who were unwell to begin with. And yet
75% of the people who went in there were unwell to begin with, had other comorbidities, and they died because of those things. But they've been chalked up as a COVID 1984 death, guys. This is what I talk about when I say the numbers are completely fudged. You can't trust the case numbers, the case counts. You can't trust the death numbers. So when people are saying, oh, this many people died or this many people died, it's like, no. You know, time and time again, we find out that those numbers are completely fudged. And in some cases, as the CDC director admitted, upwards of 75% of them have actually turned out to not have died from COVID, but they died with COVID, and they actually died from other things. And, you know, new information is coming out all the time, which would explain why it's absolutely unnecessary for pretty much anybody to get the vaccine, but especially people under the age of 20, guys. Look at this. Top epidemiologist Professor John Ioannidis has published a new study which concludes that the survival rate of people under the age of 20 who catch COVID is 99.9987%. The data used from the study was taken before the advent of mass vaccination programs, meaning the numbers apply to the unvaccinated, okay? So when we're talking about 99.9987% survival rate, this is in people who have been unvaccinated, who have contracted the COVID 1984 virus, because if you start adding in people who have been vaccinated, well, the death numbers and the unrecovery rate is going to change. But we're dealing with people who have not messed with this mRNA, gene technology, which they try to pass off as a vaccine. But here we see the data used from the study was taken before the advent of the mass vaccine programs, meaning the numbers apply to unvaccinated. United has previously published an analysis of seroprevalence antibody studies from 2020, which resulted in him being able to reveal that the infection fatality rate for COVID-1984 globally was around 0.15%, guys. In Europe, the number stood at 0.3 to 0.4, while in Africa and Asia, it went down to 0.05%. Now the professor has published new information that breaks down infection fatality rates by age, and let's take a look at it. Oh no, it's not letting me do that because I don't have internet connection in my car. Anyways, I can't blow it up, but we can see it. Well, I'll just read out to you in case you can't see it. 70 plus people who contract COVID, 4.9% of them have died. So that's it. Everyone else recovers. In the ages of 60, the 60-year-olds, 0.65%, 50-year-olds, 0.14%, 40-year-olds, 30-year-olds, 20-year-olds. In 20-year-olds, guys, it's 0.0088%. And I don't know if you can see this at the very top, age 0 to 19, 0.0013%. So virtually everyone who contracts COVID-1984 from the ages of 0 to 19 are recovering, except for 0.0013% of them. And that's why I had to point out these blatant lies that were coming from the mainstream here in Canada. Stuff like this. The truth about the Alberta teen's death and the fake news surrounding the COVID-1984 death counts, where this kid actually died from stage 4 brain cancer. But, this didn't stop them from saying it was a COVID death, and oh no, kids are dying from this, and by the time the truth came out in the back page of the newspapers, the damage was already done in the minds of the masses. That's why I put this out just the other day. 2 Ontario children under 10, COVID deaths debunked. And mandatory vaccines soon coming to Canada, guys. If you haven't seen this, make sure you check it out. 2 more children are now being used as poster kids for propaganda campaign, which is utilizing fear, while also tugging at the heartstrings of the masses. The causes of death for the 2 kids in question who died with COVID, one of them who was 4 years old, who tested positive just the day before her death, is still unknown. But this hasn't stopped the media and the pundits of this propaganda alike from spreading misinformation in an effort to ramp up the fear state among the masses so that they'll rush out and take the experimental mRNA technology they call a vaccine, guys. So really important stuff. This is why I felt it very important to put that out there. But let's continue with this article. Where is it here? Here we go. This just breaks down pretty much the numbers that we just saw in the chart. It says the authors of the study concluded that the data reflects the reality that the infection fatality rate of COVID-1984 is substantially lower than previously reported estimates. The study's findings confirm that COVID is a mild disease in all but a small minority of cases, with Omicron now reducing the severity several-fold further. Even the proponents of lockdown should be able to accept that this virus is well below a level where restrictions are justifiable, writes Jones. The results of the study once again bring into question the rationality of giving COVID-1984 vaccines to young people and to young children. Of course it does, when we see that 0.0013% is how many kids in that age range do not recover from getting COVID-1984, guys. It's just unbelievable. I really thought it was important to bring that one to your attention, guys. But we have to look at this as well. This is a pretty big story of the day, because obviously it's going to affect supply chains here in Canada. It's going to drive up prices of goods, and you thought prices were getting bad at the grocery stores. We'll just wait. Canada will require all truckers entering from the U.S. to show proof of vaccination starting on Saturday, January 15th, as part of its fight against COVID-19. That could force some 16,000 or 10% of cross-border drivers off of the roads, the Canadian Trucking Alliance estimates. Ottawa estimates that's around 5% of drivers who will be impacted, but I think I would take it from the Truckers Alliance. They probably know a little better. So we're looking at about 16,000 people, or 10% of the workforce being fired because they don't have the vaccine. Some truckers are already quitting, the group says. Trudeau has championed a strict inoculation policy for civil servants and federal regulated workers, and the fast-spreading Omicron variant of the coronavirus appears to have strengthened his government's resolve to stick with the policy. Industry groups opposed parties say it's a bad idea, especially at a time when the Bank of Canada is eyeing its first interest rate increase since October 2018. So we're talking about interest rates going up at the same time as them, restricting some supply chain issues, bottlenecking the supply chain. As we see here, supply chain and inflation concerns. In November, the price of food bought in Canada stores increased 4.7% from a year earlier, guys. That is huge. This is venturing into hyperinflation already. Never mind with the closing of 10% of the trucks not being allowed across the border there because they're unvaccinated. The largest jump in 7 years, and fresh vegetable prices rose even more due to higher shipping costs. So you're going to see some impact on inflation and on the availability of goods on sale, said Jimmy Jean, chief economist at Desjardins Group, adding that the mandate could trigger price rises that prompt the central bank to rise rates quicker than expected, guys. This is not looking good. This is why I've time and time over and over again in these videos constantly try to reiterate the fact that at this stage in the game of the COVID 1984 nightmare, if you are not actively working towards getting yourself out of debt, not reliable on the banks, not reliable on the governments, and actively working towards your own self-sustainable garden, then you are falling way, way behind. This has got to be the focus moving forward, guys, because these things are happening. It's all starting to unfold right before our very eyes, guys. I mean, let's just recap some of the things we've been saying. Truckers are now being shut down at the border. The supply chain is going to be bottlenecked, 10% of them, because they refuse to go along with this nonsense. The provinces are discussing mandating COVID 1984 vaccines. Once again, I was called a conspiracy theorist not long ago for suggesting this. Now the provinces are saying it's going to happen, and it will happen, guys. We have to prepare. It's already happening to the workforce. Federal employees, you name it. Like now, 350 TTC employees just laid off. We see it happening all over the world with booster shots being mandated for healthcare workers, office workers being mandated boosters just to get back to work, despite the fact that fully vaccinated people are making up most of the new infections. We're seeing that time and time again, more and more reports all the time. And I'm going to continue to expose these guys. Yet, despite that, they're continuing to push for all these multiple doses. It's been like a year since they've introduced this global inoculation program, and we're already talking about 3, 4, boosters, fourth shots, mandatory boosters, mandatory shots. Guys, this has nothing to do with health and everything about control. Because, look, 99.987% of people under the age of 20, for example, are not even affected by this thing. So as I said in the title of this video, COVID is not that bad. Meanwhile, you have top doctors like Dr. Bonnie Henry going around saying stuff that, being double vaxxed, having the immunity built up is not necessarily enough. You still have to get the booster in order to become what she calls super immune. It really gives you, really gives you strong antibody response, but also stimulates those memory cells. Again, your cell-mediated immunity. This is absolute insanity that a top doctor could say such a thing. Again, this came at a town hall meeting. Guys, there is no town hall to this whatsoever. I don't think I can show you it because I'm not connected, but it's just them taking pre-screened questions, guys. Obviously, if there was a real town hall, I would have been there. I would have been getting on the mic asking the questions, the real questions that nobody's asking. But that's not possible anymore because they do not want to be exposed for for what they're doing. And finally, guys, like we said, we're going to look at this COVID vaccine microchips that can allow your moves to be tracked with smartphone technology, warns an expert. People who have had a COVID-19 vaccine microchip implanted into their bodies could find their movements being tracked, it has been claimed. And you might be saying, hey, wait a minute. People are getting COVID-19 vaccine passport microchips? Like, whoa, when did this even happen? I reported on this a little while back, guys, with this one. Mandatory microchips are coming. This is not a conspiracy theory. It's just a matter of time. Mandatory vaccines are being discussed in the EU as cases continue to climb, despite the fact that the new Omicron variant emerged from the vaccinated. Meanwhile, following Sweden's announcement that the coronavirus vaccine passport requirement will be put into practice, the number of people who got microchips inserted under their skin rose, according to local media. In this video, Dan Dixon, Press for Truth, discusses the slow, incremental moves that have marched us into a world of mandatory vaccines, and also how at the same time, that same tactic will be used to usher the entire world into a global mandatory microchipping program. What was once considered by many to be a wild conspiracy theory is now turning out to be a wild conspiracy fact, ladies and gentlemen. And here it is. It was announced last week that a startup tech company had developed a device which can be embedded in arms and display someone's COVID vaccination status. At the time, Hans Sloblad, a managing director of the developing disruptive subdermals, insisted the implant was not a tracker and was only in use when scanned. However, the Express has now reported one expert who says the device will enable people to be tracked thanks to their smartphones, and concerns have been raised on how they would be used by governments in countries where people are targeted through their associations. Good point. Paul McClare, the co-founder of a different scannable medical card called MedTag, says the other companies will be able to use technology to track people. He explained, basically, the technology works on near-field communication. The chip is insert and is activated when an NFC reader is passed over it. Most smartphones are now NFC readers and can read the chip. So, while the chip in itself does not allow you to be tracked, in reality, any venue which scans it can then use geolocation to record where you have been, when you scanned, and when you checked in. This is all part of the Big Brother Orwellian surveillance grid nightmare that I've been talking about for a long time, guys. And now we're starting to see it roll out under this so-called vaccine passport system. Mr. Moncler explained that MedTag users can use this card to get medical info with the ability to send the geolocation to their emergency contacts, right? So that's the convenience of it. It doesn't enable tracking in any way, he says. He says, ours is developed for applications such as biking. If I'm biking and I'm incapacitated, it will give the first responders something to scan and basically give them my medical history. According to the MedTag's website, when your profile is accessed, your emergency contacts instantly receive an alert with the geolocation of where the device was accessed. So, while both technologies work in a similar way, McClure slammed the use of technology to track users. He added, the concern that I have is that this is fine if you have a relatively benign government, but if you're in a country where having political associations and so on is problematic, you could be basically arrested for who you associate with. When the developer said that this cannot be used to track your location, yes, it absolutely can, but not on its own. So they're already warning of the fact that hackers can hack into your microchip and gain access to your information, guys. If this is already being openly discussed in society, you know this is already a real part of the agenda, as I've been explaining for a long time. People are starting to come around to these things now. You know, it's taken a few years, but people are finally starting to come around, and it reminds me of this meme I just shared today. It's kind of funny. On the left here, you have 2020. You're a conspiracy theorist. And then this guy, well, deaths from and with COVID shouldn't be the same. You're so selfish, this one says. So he says, COVID's mostly affecting the elderly and the sick. Why can't I open my restaurant and send my kids back to school? Why are you attacking the science? The vaccines aren't stopping the COVID transmission. Fast forward to 2022. Actually, you were right. Get away from my family. I mean, it's funny because it's true. I mean, I've been vindicated time and time over again. Not that I want to be, because the things I've been saying are very scary. They're very draconian. They're very serious when it comes to our freedoms. But they're very, very real, guys. And I hope you'll pay attention moving forward. And especially when it comes to some of the things you need to focus on moving forward. Like, as I said, working towards having a self-sustainable garden so that you're no longer reliant on the grocery stores. You're no longer reliant on the big banksters. And you're no longer reliant on this government, who is the number one suspect who the finger ought to be pointed at, who's responsible for the hardships you've faced over the last 2 years, guys. COVID 1984 didn't destroy your restaurant, didn't wipe out your mom and pop business, you know, is not responsible for the alcoholism and the suicide rates and the drug use going up. No. It's the government who's responsible for all of this. Because this is based on a virus with an over 99% recovery rate. Let's get that straight. More than that, if you happen to be under the age of 20. It's all based on fear. It's all based on propaganda. And it's time we snap out of this thing. Take those masks off. Don't get vaccinated. Get healthy. Get some exercise. Eat good food. Turn off your TV. Turn off your radio. Crumple up those newspapers, guys. And continue to support the people who are bringing you this information that's countering all the mainstream propaganda that's swirling around the airwaves. Once again, guys, if you do appreciate my efforts to continuously counter all the propaganda we have to deal with on a day-to-day basis, I'd ask that you check me out here at pressfortruth.ca/donate. Once again, you can do PayPal, you can do Bitcoin, you can become a patron, you can do e-transfers. Anything helps, guys. I want to thank everybody who has contributed to my efforts. And that's all for today, guys. Just wanted to bring all of that to your information. I know it's a lot to take in one video, but, you know, these things are unraveling at an exponential rate, and we have to stay on top of it. Once again, if you appreciate my efforts to stay on top of it and to keep you in the loop, again, please check the links in the description to find out how you can support my efforts. And other than that, just share the videos, leave comments. It helps with the algorithms. Click the thumbs up button, and share this one, especially with your friends and family who you think need to see it the most. And that's all for today, my friends. I want to thank you so much for watching. Stay tuned. We're going to have more video reports coming very soon. This is Dan Dix reporting for Press for Truth. We all want truth. The truth will set you free.